My name is Mike Mayer. I'm a first-year medical student at Stanford and formerly worked as a housing program manager at Boston Healthcare for the Homeless program and as a research assistant at Boston Medical Center. I'm excited to talk to you about our paper, Encampment Clearings and Transitional Housing, a qualitative analysis of resident perspectives. Cities across the country, including Boston, are debating how best to address tent encampments, which can sometimes be sites of substance use and violence, in addition to being very visible evidence of worsening homelessness. Encampment sweeps, the removal of tents and dispersal of individuals staying there, is a common approach. However, modeling studies and other data suggest these interventions lead to increased risk for overdose death and other harms for people living in encampments. In 2022, the City of Boston conducted an encampment clearing paired with a novel intervention, low-threshold harm reduction housing spaces for displaced encampment residents. These harm reduction housing sites consisted of repurposed hotels, shelters, and healthcare facilities. These sites incorporated a harm reduction model that provided wraparound healthcare and access to social services. They also offered guests significantly more autonomy compared to traditional emergency shelters. Guests were given their own rooms and were allowed to come and go as they pleased. While many displaced encampment residents were placed in these harm reduction housing sites, some were missed and were instead displaced to other unsheltered living arrangements throughout the city. To answer the question of how tent encampment removal and harm reduction housing affect health, safety, and substance use, we recruited 30 participants who previously lived at the cleared encampment and conducted interviews with them. Of the 30 participants, 14 had been placed in harm reduction housing and 16 had not. We found that harm reduction housing improved health and safety concerns for nearly all admitted participants. Many participants felt they had made meaningful progress toward long-term stability, including achieving employment, making significant progress toward permanent housing, and initiating therapies related to chronic health conditions and addiction. These steps were largely attributed to the structure of harm reduction housing itself and the trauma-informed staff hired to support the residents. Our findings bolster growing evidence of the efficacy of housing-first models and suggest harm reduction housing may be particularly well-suited for individuals leaving encampment settings. For participants not admitted to harm reduction housing, disruption of social ties via displacement often exacerbated health and safety concerns already associated with unsheltered homelessness. These concerns, including assaults, loss of belongings, and exacerbation of mental health conditions, lasted well beyond participants' immediate displacements. Though safety concerns in encampments were acknowledged by most participants, encampments also provided an opportunity for peer stewardship and stability, which many found important for daily survival. This was raised as a significant benefit of encampment settings to traditional shelters, suggesting a need for improvements to shelter models and other structured environments. Concerns related to violence and drug use at the site of the cleared encampment have escalated since the clearing in 2022, suggesting a need for alternative approaches to tent encampments. Our findings suggest that investment in harm reduction housing at a larger scale, while avoiding sudden encampment disruptions, may more adequately meet the needs of people living in encampments. Investment in other service delivery models, including outreach-based care, harm reduction-focused shelters, and overdose prevention centers in tandem with harm reduction housing, may be particularly beneficial. To learn more about what our study found, you can read our study and the Housing and Health issue of Health Affairs.